The start of this school year has Mississippi health leaders feeling more cautious than in the past. As certain diseases spike and cause outbreaks across the country, vaccine rates are dropping in multiple counties, putting some school districts at risk. Alex Loves shares what you can do to protect your family.
At the State Department of Health, huge milestones in healthcare are celebrated on the walls, like back in 1955 when the polio vaccine became widely available and saved many. Fast forward to 1966, the measles vaccine was distributed across Mississippi, eventually eliminating the disease. But fast forward to the 2026 school year, these very diseases have top health leaders concerned again.
Among kindergartners, the Mississippi Department of Health reports 8 counties this year have vaccine rates below levels that ensure herd immunity.
When you drop below 95% of community immunity, then that's when measles can and will come back, but not just measles, diphtheria, polio coming back, or God forbid, tetanus.
Diseases that are deadly for younger age groups.
Protected our babies. I'd remind you, infants aren't vaccinated until they're 12 months old. The way we protect our babies, the way we protect our children having chemotherapy or other reasons why they can't be vaccinated is that the rest of us are vaccinated.
In case pockets of outbreaks form, Dr. Edney says students vaccinated will avoid the worst of symptoms, but anyone not should be prepared to isolate.
It will spread extremely quickly among unvaccinated, and we have to protect those children by keeping them at home during an outbreak.
So parents need to know the warning signs.
Rash with fever is typically high fever, 101, 102, conjunctivitis, which is red eyes, and a runny nose, then that's very likely measles.
With school back in session, Dr. Edney urges parents to speak with true medical experts.
Go to your doctor or your healthcare provider and have these conversations. Don't go to Facebook.
Regardless of what happens this school year, Dr. Dan Edney emphasizes that the Mississippi Department of Health is prepared to respond, and they've already met with school nurses across the state to ensure those plans are in place. Reporting in Jackson, Alex Love, 3 on your side.